Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
Welcome back. Have you noticed a change in your child's mood or behavior? Well, it's not because the holiday break is over. Here to help shed some light on why we get the winter blues, as they're called, is Dr. Sue Hubbard, an award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Nicholas Westers, a clinical psychologist with Children's Medical Center. Good morning to both of you.
Good morning. Happy New Year.
Happy New Year to you, too.
Thank you.
So I personally do not like this time of year because it gets darker so much earlier, and a lot of us fall into that slump. We get a little depressed about that.
I think you're exactly right. When daylight saving times goes away, the days get shorter, the nights get longer, we go home from work at 5 o'clock. Many people get a little sad or depressed, and some people get extremely affected by the change in number of hours of sunlight.
And this is a real thing, Dr. Westers. It's called Seasonal Affective Disorder. Tell us a little bit about what it is.
Well, Seasonal Affective Disorder is actually major depressive disorder with seasonal pattern. Sometimes happens during the summer months related to the heat and humidity, but most often during the winter months, November through February, and it has to happen at least 2 years in a row, 2 seasons in a row, and obviously in the same season.
Well, let's talk specifics. What kind of warning signs should all the parents out there, myself included, what should we be looking for?
Well, if their child is feeling depressed or more irritable, not all children can articulate their thoughts and feelings very effectively. So if they're acting out, becoming more snappier at them, and they're having trouble getting up in the morning, they're sleeping a lot more, gaining weight, they have a lot more cravings for carbohydrates.
Isn't that interesting?
Yeah. Well, I'm listening to this list and I'm thinking, well, I know my kids, maybe a lot of kids out there, may show 1 or 2, maybe a few of those signs at one time or another. So at what point do we know it's just, they're just going through a phase, having a couple of these symptoms, to something more serious?
Well, when it impacts day-to-day functioning, so if their child is getting poorer grades and they're a smart student and they're having trouble getting up in the morning more than usual. A lot of children have trouble getting up in the morning, and it's more than just because they're cold and it's dark outside, but because their mood is starting to decline and their grades are going down. And
I think it's the persistence that you need to be aware of, and the fact that, as Dr. Wester said, you notice that this happens seasonally, and after a couple of years you may clue into, like, wait, this seems to happen always in December, January.
Is there a type of person who may be more prone to the winter blues?
Not necessarily. We know that women typically experience it more than men, but children can still experience it, and it's more common in the north than in the south here. Part of it because there's less sunlight even in the north.
That's
but
true,
that doesn't mean individuals in the south, like here in Texas, don't experience it. And sometimes it can go unnoticed because we just don't assume that it's there.
Okay, so don't ignore that.
And you know, Carrie, anecdotally, I have students who go from school in Texas to the Northeast or the Northwest who really have experienced this because they've been so used to winter days with sun. So if you're sending your child away to one of those schools that's in the upper,
be cognizant
of it, because it is a problem.
Our producer Carla, who were you raised in Minnesota? But she spends a lot of time there. She's nodding her head.
Right.
Yes, it's true. Yeah, there she is. So what can a parent do if they think their child really is experiencing more than just the winter blues, something more serious?
Well, if they think it's seasonal affective disorder and they've noticed the same pattern last year and or the year before in previous years, they can get their child out in the sun more, playing outside, especially the younger children. And if it's a little bit more of a mild kind of depression, they can consider getting a light box. You can get those online or in some stores. And if it's even more serious, they should consider consulting a mental health professional to determine if it's seasonal affective disorder or a non-seasonal major depressive disorder that could turn into a seasonal affective disorder.
Are those the best forms of treatment, or
and they do cognitive? Well, they do cognitive behavioral therapy, which I think is really interesting. That we know that the child's brain is really receptive to this, and that's what Dr. Westers does.
Right.
And then there are some children who do go on that need medication, but again, that's a process. It doesn't just happen.
Interesting. Well,
but that light box really does help.
It can help. I've heard about that. Thank you, guys. Really appreciate it. You can find out so much more about seasonal affective disorder and keeping your kids healthy online at childrens.com/winterwellness or kidsdoctor.com. And you can also follow them on Twitter and on Facebook.